I'm going to tell you the best method to use for dosage calculations so that you can get 100% on your dosage calculations exam in nursing school. I'm Nicole, professional nursing tutor with over 15 years experience, and I help nursing students do a lot of things, but one of them is to get confident with dosage calculations in a single weekend. My neighbor is outside blowing leaves right now. I am sorry if you can hear that noise. So there's 3 methods that people use for dosage calculations. The most common one that I hear is formula method. Ratio and proportion is the second type, and dimensional analysis is the third. Tell me in the comments which one you're using now, and then leave another comment after this video to tell me which one you want to start using, or if you want to keep it the same. Formula method is my least favorite method, even though it's the most common. Here's why. It's because it leaves you no understanding of what you're actually doing. You really have no way of checking your answer at the end because you're not sure if you plugged in the right information. You don't understand why you plugged in what you did. It also requires multiple steps. If there's any conversions that have to be done, you have to do the conversions before you can even use the equation. And this increases the possibility of just making silly little math mistakes. Also, as dosage calculations problems get more and more complicated, the formula method just gets harder and harder to use. And if you don't know what formula to use for the specific type of dosage calculation you're doing, you're left with no options, and you're going to get it wrong on the test. So I usually find that for students, formula method is what they start out using, and they think it's working well, but then as things get harder, it just falls apart, which is why I hate the formula method for you. Ratio and proportion is great. It's actually what I used when I was in nursing school, but there's a big caveat. In my experience, ratio and proportion only works for students who are already sort of naturally good at math. You kind of just have to have this innate sense of where things need to be plugged in. And I'm guessing that's not you. That's not most people, honestly. I never have tutoring students come to me being like, I use ratio and proportion and I'm having trouble with dosage calculations. If you're using ratio and proportion, why are you watching this video? You're probably doing fine. Which leads me to the third method, dimensional analysis. Unlike ratio and proportion, dimensional analysis can be taught. It's a very clear step-by-step methodology. Unlike formula method, dimensional analysis also has some rules you can follow to check yourself. It's like one single setup. So you can do pretty much any calculation in a single step, which eliminates your silly little math errors when you have to do different conversions and make it a multi-step problem like you do often with formula method. All you need to be successful with dimensional analysis is you have to have your conversion factors memorized, which you have to do for any of the methods. So memorize your conversion factors. And then you just follow my step-by-step process and follow the rules. As long as you don't break the rules, you will never get a dosage calculation question wrong. Unfortunately, not everybody knows how to teach dimensional analysis. I did a one-on-one tutoring session with somebody the other day to teach them dosage calculations because yes, my method is so simple, I can literally teach you how to do dosage calculations in a single tutoring session. Or you can take my pre-recorded dosage calculations class. Either way, you're going to learn it. But I asked her if anybody had ever tried to teach her dimensional analysis before, and she said that one of her classmates used it and was trying to explain it to the teacher, and the teacher said, I don't know how to teach that. Here's the formula method. I can't even, guys. I can't even. I've never seen anybody teach dimensional analysis the way I have. It's different than the way you probably learned it if you ever took chemistry, because it's very specific to dosage calculations, and it's literally just a 6-step process, 2 rules you follow, and you'll never get a question wrong again. So which method did you used to use, and what method do you want to use now? And I'll tell you, if you don't want to use dimensional analysis, that's fine. If you're doing fine with dosage calculations, if it's not broke, don't try to fix it. But if it is broke, if you're not doing dosage calculations as well as you want to be, check my bio link because I've got options to help you, and give me a follow so you can get more nursing school tips.